So this is a continuation of the previous lecture on blood vessel anatomy. We had talked about kind of some general concepts in blood vessel anatomy, and then we looked at the arteries. So this lecture is going to look at the veins, and it'll be a bit shorter, and that's largely because the veins in large measure tend to mirror the arteries. And so you're going to see that. A lot of the arteries that you learned in the last lecture, there's going to be a vein that goes along with it. It's going to be right next to it anatomically, and it's going to carry the same name. So you're going to find that the veins are much easier to remember once you've learned the arteries. What I'm going to focus on in this lecture really is trying to point out the exceptions to that rule, to the unique veins that don't exactly follow the arteries. So that's where we'll spend the majority of our time. All right, so we had kind of one mother artery coming out of the heart, and that was the aorta, if you remember from the arterial lecture. We're going to have one kind of mother vein that all the other venous blood drains into, but we're going to separate this one vein into a superior vena cava and an inferior vena cava. They both empty into the right atrium, but the right atrium kind of separates the superior from the inferior vena cava. So the superior vena cava is going to drain all of the blood returning from the head, the neck, the shoulders, the upper extremities. All of those are going to, and largely the trunk, all of those are going to empty into the superior vena cava. The inferior vena cava is then going to receive blood from the rest of the body. So we're talking about the abdomen, the pelvis, and the lower extremities. So if we start with the head and neck, so when we did the arteries, we started from the heart and we worked our way up, because the heart was the source of that new, freshly oxygenated blood. Well, now that we're talking about the venous system, we need to kind of flip our thinking. We're not going to start at the heart, we're going to end at the heart, because we want to take kind of old, used up, deoxygenated blood, and we want to return it to the heart. So we're going to start with the source of that used up blood, which is the different parts of the body, and then we're going to work our way back to the heart. How does that used up, deoxygenated blood get back to the heart? And we're going to separate it into regions just like we did for the arteries. So let's start with the head and neck. And what we'll find is that we're going to get some, starting at the top, we're going to get a venous return from the brain is going to occur through what we call sinuses. And sinuses are like veins in that they are kind of receiving that used up blood, but they're not veins in the traditional sense. They don't have the same layers of tissue that veins have. Instead, if you remember when we were talking in the nervous system lecture, we talked about how the dura mater actually has two layers of dura, and sometimes in between those two layers there are sinuses that collect venous blood. And so what we're going to find is that some of the largest collections of venous blood from the brain occur in these sinuses. And so there's a couple of them that I want you to know about. We're not going to learn most of them, but there are a few that you will see later on as you do your medical studies, whether in nursing school or medical school or wherever you're off to after this. And so I just want you to be aware of them so that when you hear people talking about them, you know what they're talking about. So one of the big ones is the superior sagittal sinus, and on the picture that's going to be right in the middle, in between the two hemispheres of the brain, as the dura mater kind of dips down into that deep fissure, that in the deep longitudinal fissure in between the right and left hemisphere. The dura mater dips down into that fissure, and because there are two layers, there is space in between the two layers for this sinus to develop, which receives venous blood from multiple areas of the brain. The other sinus I want you to be aware of is what we call the cavernous sinus. You can see that over here. And that's going to be this sinus that drains part of the front of the brain. A lot of the veins behind the eye, for example, they're going to go ahead and drain to that sinus. Eventually, multiple sinuses will all come together at what we call the confluence of sinuses, and that's going to be posteriorly near the lambdoid suture, if you remember that from our bone lecture. So that's going to, the confluence is going to end up being kind of posteriorly. It's not shown well on this picture, but it's going to end up being, the lambdoid suture is going to be around there. So you're going to get the superior sagittal sinus, you're going to get the straight sinus, you're going to get cavernous sinus draining back, and they're going to kind of come back at this confluence of sinuses we'll see on another picture. So from those sinuses in the brain, how does the blood then leave the brain? How does the venous blood leave the brain? Remember, it has to make its way down to the heart. It's going to do that through the internal jugular veins. Okay, just like we saw on the carotid artery, we had an internal carotid and an external carotid. Here in the jugular vein, we're going to have an internal jugular, and that's going to drain the blood from the brain, just like the internal carotid supplied fresh blood to the brain. The external jugular is going to basically drain blood from the face, just like the external carotid provided blood to the face. So you can think of, we don't have carotid veins. The kind of the veins that are analogous to the carotid arteries are the jugular veins. So you've got an internal and an external. Okay, so all of these sinuses eventually are going to drain into the internal jugular vein. The face is going to drain into, this should say, sorry, that should say external jugular vein. That's a typo there. All right, and then eventually the internal, you see here, and the, here, let's change the color. Let's make this something we can see. The internal jugular and the external jugular are going to eventually drain into the right brachiocephalic or left brachiocephalic trunks, depending on what side they're on. Okay, then there is a vertebral vein, just like there was a vertebral artery, and so it follows, if you remember the artery was back here, it follows the vertebral artery, and it's going to drain the posterior circulation as well as the cervical spine. And it's also going to eventually dump into that brachiocephalic trunk. If we kind of turned the brain upside down and took a look at what these sinuses and veins look like there, you could see that you're going to eventually get everything coming together at the confluence of sinuses that I talked about. And from the confluence of sinuses, you're going to go into the transverse, the sigmoid, and then into the internal jugular. Let's look at it here on a arteriogram. This would actually be a venogram, since it's not arteries that we're injecting but veins. So on this venogram, you can see kind of what we're talking about. You've got let's see here, you can see the superior sagittal sinus we were talking about, right in between the two hemispheres of the brain. Can't really see the cavernous sinus on here. It would be back in there somewhere behind the eyes. Anyway, those are all going to eventually drain to this confluence of sinuses, and then in order to leave the brain, they go through the transverse and the sigmoid sinuses, and then out through the internal jugular veins. So you're just kind of getting a view of this from different angles. This would be an anterior to posterior view. Okay, so that's how things drain from the head and neck into the right or left brachiocephalic trunk. So if you remember when we were talking about the arteries, we had a right brachiocephalic trunk that then split off into the subclavian and the carotid, if you remember that. That was on the arterial side. And then on the left, we didn't have a brachiocephalic trunk at all. We just split right off into carotid and subclavian. Well, the venous system is a bit more symmetrical. So you're going to get a right brachiocephalic vein and a left brachiocephalic vein. So you can see here would be the right and here would be the left. And we just talked about the internal jugular and the external jugular and the vertebral veins all draining into that brachiocephalic vein. Then that brachiocephalic vein becomes the The subclavian is going to come off of the brachiocephalic trunk. You can see it starting just about where those blood vessels come in and drain into the brachiocephalic trunk. It's going to split off and become the subclavian, both on the right and the left. So we talked about subclavian arteries. So these subclavian veins are going to just mirror the arteries on either side. We're also going to get some mirroring of some of the other blood vessels. So you're going to have an axillary vein, and we had an axillary artery. That axillary is going to then separate into a brachial vein, and we had a brachial artery, if you remember. There's also going to be a cephalic artery. Now this is a little bit different than what we saw before. And we'll take a look at the drainage from the arm here in a minute. So, but if you look at the shoulder, you can see that there's really only a few veins that you have to know, and these are names you've heard before. So brachiocephalic, subclavian, axillary. Cephalic is going to be a new one that you're going to have to add. A couple of other ones I just wanted to mention in the chest, because these are where the drainage from the trunk eventually ends up before it goes into the vena cava. So you've got the azygous vein and the hemiazygous vein. So you see over here, azygous, and that's going to drain into the superior vena cava. And you've got the hemiazygous over here, which eventually, of course, drains into, part of it drains into the azygous and then into the vena cava. But that's how you get the blood return from the trunk back into the superior cava. It's through that azygous and hemiazygous vein largely. Okay, let's take a look at the arms a little bit more closely. So if you remember, we had that axillary that turned into brachial, and we had that cephalic veins. We're not going to, this one is showing us some in the abdomen too. We're going to kind of ignore the abdominal ones and kind of focus on the arm. So when you get here to the elbow, and I only mention this because for those of you who will be drawing blood or putting in IVs, we tend to focus a lot on this antecubital fossa, and that's because this median cubital vein is quite large for a vein on the arm, and more than just being large, it's pretty close to the surface, and so it tends to be one that we like to put IVs into that median cubital vein. Remember, the cephalic vein was coming down on the radial side, so we still see that cephalic vein is still coming down. The median antebrachial nerve is going to be kind of splitting here, branching and coming down to the hand, so it's kind of more in the central part of the hand. And then you've got an ulnar vein that runs deeper. If you see that ulnar vein running deeper there. And a radial vein we should see on the other side also running deep. So if you remember when we talked about the muscles, we talked about different layers, right? Well, here with the veins, we've also got different layers. We've got some superficial veins and we've got some deeper veins. So the superficial veins are going to be the cephalic, the basilic that you can see running here on the ulnar side, and that median antecubital and the median antebrachial. So those, you can think of those as the superficial veins of the forearm, the cephalic, the median antebrachial, and the basilic. And you can think of them as which one is on the radial side, that's the cephalic, which one is in the middle, that's the median antebrachial, and which one's on the ulnar side, that's the basilic. So if I'm asking you for superficial veins of the forearm, there's really only 3, and you can identify them based on their position, either close to the thumb, close to the pinky side, or in the middle. Okay, then if I ask you for a deeper vein, there's only 2, the radial and the ulnar. Those should be easy to remember. Their locations are similar to those terms that you've learned before, and you should be able to identify those easily as long as you know we're looking at deep veins of the arm. So keep them separate in your mind, and as you're learning them, which ones are superficial, there's 3 of them, where can they be found? Which ones are deep, there's 2 of them, and where can they be found? And so they're going to drain the vein from the hand and from the forearm, and they're going to carry it up into eventually the subclavian, and that subclavian is going to go into the brachiocephalic vein and back into the vena cava. All right, so on a picture of the neck like this, and I'm showing you this because, especially those of you who are gonna learn how to put IVs or central lines into patients, whether that's going to be a doctor or a nurse anesthetist or whatever you may be, you may find that you need to get IV access in one of these large veins because the smaller veins in the arm or the hands or the feet just are not accessible. Either the patient is super dehydrated or their blood pressure is very low, and so you may have to get one of these large veins. And so it'll be useful for you to understand the anatomy of the neck and the shoulder because that's where we tend to put these central lines in. So let's start from up at the top. We're going to see both arteries and veins. So on the picture, the arteries are going to be the white structures, the large white structures, like for example, this is going to be the carotid. And the veins are going to be kind of that darker reddish purple, and they almost look bigger, and that's because they're floppier and they're more distensible, and so sometimes in a cadaver they tend to look bigger. So we've got the common carotid here, and then remember what's analogous to the carotid is the jugular vein, right? So excuse me, here is the external jugular vein, and that's going to be the one that goes up and kind of drains the face and the scalp. Deeper to that is going to be the internal jugular, and we can't really see all of it, but you can see on this side, you can see it. So here on this side it's been cut away. On this side you can see it going all the way up, and then it's going to go kind of deeper inside. So the internal jugular is a little bit of a deeper structure, but sometimes we can still find it using ultrasound, and we'll put a central line in there. Often we are putting a central line here in the subclavian vein, and that's partly because it is fairly close to the surface, and it's really large and very close to the heart. So if we can thread a catheter into that vein, then we can give all of the medicine and fluids and blood products that we need, and that vein is large enough that it can handle pretty much anything we put in there. And you'll notice that the subclavian vein really mirrors the subclavian artery, which is running just kind of behind it, below it. And so often we're going to put a central line in there. Then you can see that flows into the right brachiocephalic vein. You can see a little bit of the left brachiocephalic vein coming off as well. So make sure that you could find those major arteries and major veins on a cadaver photo like this. So there's really only a couple of veins, internal and external jugular, subclavian, brachiocephalic, and a couple of arteries, brachiocephalic trunk, internal carotid, external carotid, and subclavian. Remember, the arteries are kind of the smaller, white, rounder objects, and the veins are kind of flatter and darker colored. All right, as we go down to the legs, we're going to follow from the feet, and we're going to work our way upward towards the inferior vena cava, where everything is going to eventually drain into. So if we look down at the feet, we've got our very similar veins to the arteries that we looked at. So we've got anterior and posterior tibia, we've got fibular, so these are the same as the arteries, popliteal, same as the arteries, and femoral, same as the arteries. So the only, and iliac, same as the arteries. So the only difference here in the leg really is this saphenous vein, and you should be aware of that name. So there are two saphenous veins. There's a greater and a small, sorry, a great and a small saphenous vein. The one that's probably more important to remember would be the great saphenous vein. So you just remember that's going to run medial and posterior, okay? Medial and posterior, that's going to be the great saphenous vein. If you look posterior and more in the middle and kind of veering off laterally, that's going to be the femoral. So the two big veins posteriorly are the great saphenous medially and the femoral more laterally. And then the posterior and anterior tibial and fibular, they're going to follow the arteries, and the external iliac is going to also follow the arteries. As we get into the abdomen, we're going to find really a lot of mirroring of those arteries that you learned. So I just want to point out here in the abdomen the one different vein that does not have a corresponding artery to it, and that's called the hepatic portal vein. And so the portal vein actually connects the small intestine with the liver, and even part of the stomach. And so what you'll learn when we get to the gastrointestinal system is that, especially in physiology, is that eventually once your food is broken down into its component parts, into parts that are absorbable, those nutrients get absorbed into the blood supply and they go directly into this portal system. So before those nutrients go anywhere else in your body, they go to the portal vein. And the portal vein carries this blood from your gastrointestinal tract to the liver. And there's a reason for that, because the liver is really helpful in detoxifying blood. If there's any drugs that you've consumed or any toxins, going to the liver first is a protective measure, because the liver has the ability to remove some of those toxins or to neutralize some of those toxins. The liver is also a big storage organ, so if you have excess glucose, for example, it can be stored as glycogen in the liver. So delivering it to the liver first is helpful so that you can store some of those nutrients. And so for lots of reasons, it's helpful to go to the liver first, and we'll talk about that more in physiology. But I want you to understand anatomically that you're getting drainage coming from the gastrointestinal tract, and it's going not into the vena cava like everything else does, but it's going rather into this portal system. So the portal vein then carries that to the liver, and the liver is going to store some stuff, it's going to detoxify some stuff, and other stuff it's just going to let drain into its own venous system, which is called the hepatic vein. So you've got a portal vein that connects the gastrointestinal tract to the liver, but then you've got hepatic veins that connect the liver to the vena cava, okay? And so the liver ends up being the only organ that really dumps directly its used up blood into the vena cava. Everything else dumps into another branch that eventually dumps into the vena cava, but the liver does it directly through the hepatic veins. So I want you to understand the difference between the portal vein, which carries blood to the liver from the gastrointestinal tract, and the hepatic veins, which carries blood away from the liver into the inferior vena cava. All right, we will discuss this more in class. We have some models there that you can look at, as well as some more pictures. And eventually when we do the dissection of the pig, hopefully we'll be able to see some of these structures together.